Hello friends, welcome to my YouTube video. In this video, we will be talking about Lumbini province Loksewa medical officer 8th level Nepal Health Service. Exam date was 2083. बैसाख 25 गते MCQ 25 गते MCQ exam and 26 गते they were subjective exam. So moving to the question. So first moving to the first paper, that is MCQ. So प्रदेश लोकसभा आयोग लुम्बिनी प्रदेश निजामती सेवा अंतर्गत प्रदेश स्वास्थ्य सेवा जिला हेल्थ सर्विस समूह अधिकृत स्तर 8 तह प्रारंभिक मेडिकल अधिकृत पद को खुला तथा समावेशी प्रयोगात्मक लिखित परीक्षा मिति वैशाख 25 गते प्रथम पत्र that is MCQ. टोटल पूर्णांक 6 मार्क हुन्छ. टाइम चाहिँ 1 घण्टा 15 मिनट. टोटल नंबर of question 6 प्रश्न 1 अंक 6 मार्क हो. So moving to the question. A 25-year-old male develops hypotension wheezing after bee sting. What is the drug of choice for the initial management? So options are A. Adrenaline, B. Antihistamine, C. Hydrocortisone, D. Salbutamol. So answer will be adrenaline. Which of the following? Moving to the question number 2. Which of the following is not a risk associated with large volume crystalloid infusion? Large volume crystalloid infusion. So options are anaphylaxis, hemodialysis, hypothermia, edema. So the answer will be which is not a risk associated with large volume crystalloid infusion. So it can cause hemodilution, it can lead to hypothermia, it can lead to edema as well, but it will not cause anaphylaxis because it is a fluid, not blood. Question number 3. Moving to the question number 3. Which of the following condition may result in chronic toxicity? Option A. Pulmonary malignancy, kidney failure, hepatic malignancy, dementia. The answer will be kidney failure. Moving to the question number 4. A 30-year-old patient gives history of fall from height. His X-ray report of the left ankle show calcaneus fracture. What is the next X-ray that you do in this case? So in this case, which will be the next X-ray that will do? So options are chest X-ray, B. X-ray of the spine, C. X-ray of pelvis, D. X-ray of thigh. The X-ray which will be done will be X-ray of spine. Moving to the question number 5. You are treating a patient with salicylate poisoning, that is aspirin poisoning. Acute, severe salicylate poisoning, serum level greater than 100 mg per deciliter, require a specific treatment to remove absorbed toxin. What is the therapeutic modality of the choice? A. Acidification of the urine, B. Charcoal hemoperfusion, C. N-acetylcysteine, D. Hemodialysis. So the answer will be hemodialysis. Moving to the question number 6. Which of the following is considered intrinsic characteristic of emergency medicine that affects safety, patient safety? Of intrinsic characteristic of emergency medicine. So A. Fatigue, B. Inadequate staffing, C. Multiple interaction or distraction, D. Overcrowding. Answer will be multiple interaction or distraction. Moving to the question number 7. During post cardiac arrest, which is the recommended duration of targeted temperature management after reaching the correct temperature range? At least 36 hours, at least 8 hours, at least 24 hours, at least 48 hours. So during post cardiac arrest care, what is the recommended duration of target temperature management after reaching correct temperature range? The answer will be at least 24 hours. Question number 8. Abdominal ultrasonography in 3-year-old boys was circumscribed hypoechoic renal mass. The most likely diagnosis is A. Williams tumor, B. renal cell carcinoma, C. megaloblastic lymphoma, D. oncocytoma. So answer will be Williams tumor. A. Williams tumor. Question number 9. A 78-year-old male visited your OPD with complaint of low back pain and generalized weakness for last 1-2 years. He has been evaluated outside and found to have anemia. Creatinine was a little bit raised and has anemia. Similarly, calcium was high. Axial lumbosacral region, so osteolytic region. What is the likely diagnosis? So A. acute renal failure, B. iron deficiency anemia, C. lung carcinoma, D. multiple myeloma. So it's feature of like bone cancer. One of the most common bone cancer is multiple myeloma. Question number D. Color Doppler is used in diagnosis of all except peripheral vascular disease, B. D. venous thrombosis, C. pulmonary embolism, D. bone tumor. So answer will be bone tumor, where color Doppler is not used as a diagnosis. Question number 7. A 62-year-old male with carcinoma of the descending colon, present with acute intestinal obstruction. The treatment of choice is A. defunctioning of colostomy, B. Hartmann procedure, C. total colectomy, D. left hemicolectomy. So answer will be Hartmann procedure. Carcinoma of the descending colon presenting with acute intestinal obstruction. So answer will be Hartmann procedure. Moving to question number 12. Question number 12. A 24-year-old man has extensive bone across his chest from an explosion at a factory. Bone across his chest. He is intubated but remains difficult to ventilate. After confirmation of endotracheal intubation, which of the following is the next important step in management? After confirmation of endotracheal intubation. So A. analgesia and sedation, B. chest stylotomy, C. tetanus prophylaxis, D. transfer to a bone center. So it is a bone patient. In bone, we know stylotomy is very important procedure that helps with really kind of constriction. So question number 13. Which of the following is physical finding is a marker for spinal shock? Physical finding for marker for spinal shock. So A. Braminsky response present, B. bulbocavernous reflex absent, C. lower extremity hyperreflexia present, D. perineal sensation present. Answer will be bulbocavernous reflex absent. Question 14. A 30-year obese lady complained of primarily severe perianal pain for 2 days. Examination revealed brownie induration area just to the right side of the anal bulge. Rectal examination was painful. What should be the next step in the management? A. Incise the indurated area and look for pus. See the response to the course of ciprofloxacin. See the response to counsel of flucloxacin. Start seize bath and antibiotic. A. Incise the indurated area and look for pus. Indurated area and look for pus. Similarly, question number 15. A 23-year lactating mother presented with painful swelling in the outer upper quadrant of her left breast. The affected area is red, tender, and fluctuant. What is the most important treatment of this condition? A course of flucloxacin, B. aspiration of milk, C. cabergoline, D. drainage of pus. So answer obviously will be drainage of pus because pus is collected there. So question 16. Trauma and injury severity score TRISS include A. GCS plus BP plus respiratory rate, B. RTS plus ISS plus age, C. RTS plus ISS plus GCS, D. RTS plus GCS plus BP. So answer will be RTS ISS plus age. TRIS score. Trauma and injury severity score, TRIS score. Question number 17. What play a key role in inflammatory phase of wound healing in skin? So A. macrophage, B. fibroblast, C. collagen, D. platelet. Answer will be macrophage. Question number 18. A patient with head injury open eye to painful stimulus using inappropriate word and localizes pain. What is the GCS score? Open to painful stimulus using inappropriate word localizes pain. Then his GCS will be A 8, B 10, C 12, D 14. Answer is 10. Question 19. A 50-year male is undergoing lateral repair of inguinal hernia. What is done in this surgery? A. Inguinal canal is closed by double breasting with proline stitch. B. Mesh is placed over the fascia transversalis. C. Mesh is placed over the internal oblique muscle. D. Mesh is placed over the peritoneum. So answer will be B. Mesh is placed over the fascia transversalis. Moving to the question number 20. Load plication is done for A. Inguinal hernia, B. Testicular cancer, C. Hydrocele, D. Testicular varices. So answer will be hydrocele load plication. Question 21. Which condition is commonly known as pink eye? A. Cataract, B. Glaucoma, C. Conjunctivitis, D. Astigmatism. Answer will be conjunctivitis. Question 22. The most common cause of ocular morbidity in Nepal is A. Cataract, B. Refractive error, C. Conjunctivitis, D. Trachoma. So answer will be refractive error. Question 23. Ptosis in Horner syndrome is due to paralysis of A. Mueller muscle, B. Riolan muscle, C. Horner muscle, D. Orbicularis oculi muscle. Answer is Mueller muscle. Question 24. A 25-year-old male rushed into emergency with history of spillage of lime in his eye while working in construction area. Most immediate treatment is A. Cold compression, B. copious irrigation with water, C. neutralization of the chemical, D. ocular lubricant. Answer will be copious irrigation with water. Question number 25. Which of the following fungus is more common agent for causing automycosis? A. Aspergillus fumigates, B. Mucor, C. Candida, D. Histoplasma. So answer for automycosis, the answer will be Aspergillus fumigate. Moving to the question 26. A mother of 3-year mischief child notices foul smelling discharge from the right nostril since 1 week. What is the most likely diagnosis? From the right nostril there is a foul smelling discharge since 1 week. Answer options are antroconal polyp, B. conal atresia, C. chronic sinusitis, D. foreign body. So in children obviously foreign body is very common cause of foul smelling discharge from the nostril. Question 27. Which is the most common benign oral lesion? A. fibroma, B. pyogenic granuloma, C. mucocele, D. ameloblastoma. So answer is fibroma. Question 28. Which is the most common cause of gingival bleeding? A. scurvy, vitamin C deficiency, use of hard brush, B. C. dengue, D. gingivitis. Answer will be gingivitis. Question 29. A 65-year-old male patient came to dental department with history of tobacco chewing for the last 30 years. Tobacco chewing and complaint of reddish mark in the cheek mucosa. On examination, reddish mucosa can be seen bilaterally in cheek. Which of the following suggests a presentation that can be converted into malignancy? A. erythroplakia, B. leukoplakia, C. lichen planus, D. oral submucosal fibrosis. So answer will be erythroplakia. Question 30. So question number 30. Which of the following nerve is involved in anterior dislocation of the shoulder joint? A. musculocutaneous, B. axillary, C. radial, D. ulnar. So anterior dislocation of the shoulder joint, answer will be axillary nerve. Question 31. The acute osteomyelitis is commonly caused by A. epiphysis, B. metaphysis, D. Diaphysis. None of the above. Answer is metaphysis. Question 32. Accept 79-year male came and you diagnose intertrochanteric fracture of the right side dead. What is the duty to do now? A. Skin traction. B. Inform to ortho on duty to take over the case. C. Analgesic. D. Intertrochanteric fixation. Answer is analgesic. Question 33. Erb's palsy. Erb's palsy. All the movement are lost except A. Supination. B. External rotation as shoulder. C. Abduction as shoulder. And D. Pronation. So pronation is preserved or the all movement are lost. Question 34. Which maneuver is appropriate for introducing a flexible fiber optic scope to examine hypopharynx? A. Barbosa maneuver. B. Hemlich maneuver. C. Muller maneuver. D. Epley maneuver. Answer is Muller maneuver. For inserting flexible fiber optic scope. Question 35. Which muscle relaxant is of choice in hepatic and renal failure patient? A. Cystacurium. B. Rocurium. C. Vecurium. D. Rapacurium. So answer is Cystacurium. Question 36. A 30-year-old man with history of epilepsy is scheduled for surgery. The anesthetic wants to use induction agent that has anticonvergent property and provide rapid onset and short duration of action. The patient has no known allergy. Which induction agent is the best choice? So, and they want to use induction agent that has anticonvergent property and is rapid in onset and has short duration of action as well. And they know allergy. So answer is intermediate. B. Ketamine. C. Propofol. D. Thiopental sodium. So appropriate answer will be Propofol. Question 37. C in C reactive protein stand for A. Capsular polysaccharide in pneumococcus. B. Concavalin. A. C. Cal-retin. D. Cellular. Answer is capsular polysaccharide in pneumococcus. Question 38. Laboratory analysis of a patient revealed a sodium level of 151. Urine sodium of 20 less and urine osmolality of 280. Critical examination doesn't reveal edema, the low extremities or an elevated jugular pressure. What is the most likely diagnosis? A. Acute tubular necrosis. B. Central diabetes insipidus. C. Cushing syndrome. D. Syndrome of inappropriate antidiuretic hormone. Answer will be central diabetes insipidus. Question 39. Which is the most reliable cardiac enzyme for the diagnosis of myocardial infarction of 24 hours? A. CKMB. Option A. CKMB. B. Troponin I. C. HDL. D. LDL. So answer will be troponin I. Question 40. What is the most common cause of anemia in pregnant women? A. Folic acid deficiency. B. Iron deficiency. C. Sickle cell disease. B. Beta thalassemia. Answer is iron deficiency. Moving to the question 41. Premenstruation syndrome has constellation postural symptom. Which of the following would not be expected? A. Abdominal bloating. B. Constipation. C. Anxiety. D. Weight loss. So answer will be weight loss. Question 42 or 30. Question 42. Question 42. A 35-year G2A1 lady with uncontrolled gestational diabetes mellitus was admitted in second stage of labor. After the delivery, the head, shoulder are not delivered and total sign is seen. What would be the first step to manage this condition? Apply superfluous pressure. B. Call for help and keep mother in McRoberts position. C. Remove the posterior limb. D. Roll the patient over. So answer is B. Call for help and give the patient a mat robot position. Moving to question number 43. Question number 43. An hypertensive pregnant lady at 35 weeks of gestation came with pre-bleeding and decreased fetal movement. On examination, uterus is contracted and tone is raised. There is fetal bradycardia. What is the most likely diagnosis? A hypertensive pregnant lady at 35 weeks of gestation with bleeding and decreased fetal movement. On examination, uterus is contracted and tone is raised. Fetal bradycardia. What is the most likely diagnosis? A. Average placenta. B. Placenta previa. C. Preterm labor. C. Uterine rupture. Answer is A. Average placenta. A. Average placenta. Moving to the next question, that is question 44. A drop in the fetal heart rate that typically lasts less than 2 minutes and is usually associated with umbilical cord compression is called A. Early detection, late early deceleration. B. Late deceleration. C. Variable deceleration. D. Prolonged deceleration. So this is a question from known as stress test cardiac topography. So answer is variable deceleration. Moving to the question 45. How much blood loss is necessary to slow first show hypotension? A. 30%, A. 10%, B. 20%, C. 25%. Answer is 30%. Question 46. A 37-year-old woman on oral contraceptive present with periodic chest pain and shortness of breath. Which of the following findings is most specific for pulmonary embolism? A. Autoelectasis. B. Hartmann syndrome. C. Normal radiographs. D. Westermann sign. Answer will be Westermann sign. Moving to the question 47. A 25-year female Gravida 2 Priority 1 at 24 weeks of gestation came for routine checkup. Her ultrasound showed fetus at 24 weeks of gestation in frank breech position with no other abnormalities. What is the most appropriate next step in the management? Is A. External version. B. Glucose challenge test. C. Immediate LHCS. D. Immediate induction vaginal delivery. Answer is glucose challenge test. Moving to the question 48. A primary gravida at 37 weeks of gestation presented to emergency with history of PV bleeding. She diagnosed to have placenta previa. Fetal heart rate was normal. What is the best management in this case? A. Cesarean section. B. Expected management. C. Induction of labor. D. Instrumental delivery. Cesarean section. A is the right answer. Which one is the most common manifestation of rheumatoid fever? A. Arthritis. B. Carditis. C. Cholera. D. Nodule. Answer is A. Arthritis. Question 50. In bacterial meningitis, subdural effusion is most common due to A. Meningococcus, B. Pneumococcus, C. Haemophilus, D. Tuberculosis. Answer will be C. Haemophilus. Which of the following is the most common cause of diarrhea in the children? A. Shigella, B. Salmonella, C. Rotavirus, E. E. coli. So answer is rotavirus. Question 52. When does the umbilical typically fall in a normal term infant? At 2 days, 2 weeks, 1 month, 2 months. Answer is 2 weeks. Question 53. A 2-year-old child having difficulty having difficulty breathing. What finding would most likely lead you to suspect upper airway obstruction in this child? A. Expiratory breath sound. B. Decreased expiratory effort. C. Increased inspiratory effort with retraction. D. Normal inspiratory sound. So answer is C. Increased inspiratory effort with retraction. Question 54. Question 54. A 4-year-old boy brought to emergency department by his mother. He is lethargic. Retraction and nasal flaring. His respiratory rate is 70 per minute. Child is 4 years. With warm extremities and weak capillary refill. Which is the immediate life-threatening condition that the child most likely to progress to if left untreated? A. Cardiogenic shock. B. Hypovolemic shock. C. Respiratory distress. D. Respiratory failure. Answer will be respiratory failure. Question number D. Question number 55. A child was reported to speak two words together, run, look at face to check emotion, and play more than one toy at a time. What is the mental age of the child? A. 18 years. B. 24 years. C. 28 month. D. 24 month. D. 32 month. Answer will be 24 month. That is 2 years. Question 56. A child who is snoring and mouth breathing was found to fail to thrive. Which of the following does it suggest? A. Mononucleosis. B. Obstructive sleep apnea. C. Anti-meningeal. D. cerebral palsy. Answer is obstructive sleep apnea. Moving to the question 57. If a dietary iron is not provided, infant begin to deplete their iron store by 4 months, 2 months, 6 months, 12 months. So answer is A. 4 months. Question 58. A neonate was born at term by vaginal delivery. The baby required active resuscitation at birth. At 5 minutes, the baby had heart rate of 90 beats per minute. Irregular respiration, arm and leg were flexed. Weak cry on stimulation and peripheral cyanosis. What is Apgar score? So A5, B6, C7, D8. Answer will be A5, B6. Question 59. So police brought 4 men in emergency room to examine before taking custody. As a detainee, in which format you will prepare the report according to our law. A. No format is necessary. Report is prepared in plain paper and given to police. B. Format prepared by the police office with some question. C. Format prescribed by the law for drunkenness examination. Format prescribed by the law for injury examination. Answer is D. Format prescribed by the law for injury examination. Question 60. Most effective method for changing health behavior in community is A. Lecture method. B. Demonstration method. C. Group discussion. D. Role play. Answer is group discussion. Question 61. Which of the following is initial management in the investigation? Which of the following is initial management in investigation of an epidemic? Is A. Defining the population at risk. B. Confirmation of persistence of an epidemic. C. Verification of diagnosis. D. Rapid search for all cases and their characteristics. So answer is C. Verification of diagnosis. Moving to the question 62. Question 62. All patients from the batch were evaluated for yearly occurrence of flu after yearly flu vaccine. Out of 50 students who were observed for 5 years, 10 students has unknown incidence of flu. What type of study is this? A. Case control. B. Cohort. C. Experimental. D. Cross sections. The answer is cohort study. Question 63. Which epidemiological study look at the distribution of disease or health related characteristic in human population and identify the characteristic and association of the disease? A. Descriptive epidemiology. B. Experimental epidemiology. C. Analytical epidemiology. D. Ecological epidemiology. Answer is A. Descriptive epidemiology. Question 64. A male child with history of sexual abuse is brought to you. Which of the following findings will suggest that the child has been victim of multiple sexual abuse? A. Anal fissure with hyperpigmented perianal area. B. Dilatation of anal opening more than 1.5 cm with no stool present. C. Dilatation of anal opening more than 1.5 cm with stool present. D. Loss of subcutaneous tissue of more than 50% around the anus. B. Dilatation of anal opening more than 1.5 cm with no stool present. 65. Contraindication of anti-rabies vaccine. A. Pregnancy. B. Immune compromised patient. C. Re-exposure to animal bite. D. None of the above. None of the above will be the answer. Moving to the question 66. The recommended pH for drinking water is A. 4.5 to 6.5. B. 5.5 to 7.5. C. 5.5 to 8.5. D. 6.5 to 8.5. Answer 6.5 to 8.5. Question 67. Which disease has the row C basic reproductive number? Is A. Measles. B. COVID-19. C. HIV. D. Smallpox. The answer is measles. Question 65. Question 68. A nurse who got needle prick at emergency during treatment of HIV patient. She has to take prophylaxis antiretroviral. A. Immediately within 72 hours. C. Within 1 week. D. Once symptom appear. So B. Within 72 hours. Question 69. Which of the following pneumonia severity score is the most sensitive for predicting the need for intensive respiratory or vasopressor support? A. CORB 65. B. CORB. C. Pneumonia severity index. D. Smart cough. Answer is smart cough. Question 70. So question number 70. Which among the following is the best method for controlling leprosy? A. Vaccination. B. Health education. C. Chemoprophylaxis. D. Health hygiene. So for controlling leprosy, best option is health education. (71) Fabricated wounds are mostly A. Abrasion. B. In used wound. C. Contusion. D. Laceration. Answer is laceration. 72. Which of the following is the main vision of Nepal National Health Policy 2019? A. Health for all through universal health coverage. B. Free tertiary care for all citizens. C. Expansion of private health institute. D. Focus on communicable disease only. So answer is health for all through universal health coverage. Question 73. A child is brought to the casualty with report of violent shaking by parent. Most likely injury is long bone fracture, rupture spleen, C. Subdural hematoma, D. Skull bone fracture. Answer is subdural hematoma. Question 74. The earliest sign of death is A. Loss of skin elasticity, B. corneal clouding, C. cooling of body, B. Postmortem lividity. Answer is cooling of body. Moving to the next question. Question 75. What is the target of infant mortality rate in second long-term health plan in Nepal? A. 34.4 per thousand live birth, B. 30.4 per thousand live birth, C. 36.4 per thousand live birth, D. 20.4 per thousand live birth. So answer is 34.4 per thousand live birth infant mortality rate in second long-term plan. Moving to the question 76. In a stage of grief reaction, which one is correct? A. Denial, anger, bargaining, depression, acceptance. B. Denial, anger, depression, bargaining, acceptance. C. Denial, anger, depression, acceptance, bargaining. D. Anger, denial, depression, bargaining, acceptance. Answer is denial, anger, bargaining, depression, acceptance. So, option A is the correct answer. Now moving to question 77. Shahid Dhanbhag Waqt National Transplant Center was established on A. 2015, B. 2013, 2016, 2017. Answer is 2013 AD. Question 78. Into the Nepal Health Service Act, all employees will get how many days of sick leave in 365 days of his job? A. 15 days, B. 30 days, C. 20 days, D. 12 days. Now moving to the another question, that is 79. All are true statement about adipocere except A. Open assessment, B. Seen if body is buried in moist soil, also called mummification, formation of vase-like substance. Answer is all are true except about adipocere except also called as mummification. Question number 80. Which are the following is the likely source of posterior epistaxis? A. Anterior etomotor artery, B. greater-palatine artery, C. Kessel-Bach plexus, D. sphenopalatine artery. Answer is sphenopalatine artery. Moving to the question 81. High altitude pulmonary edema can difficulty establish from acute distinguished from acute mountain sickness. Although pathophysiology of each is similar, the treatment and prognosis are different. Which are the following features is indicative of HAPE, that is high altitude pulmonary edema associated with AMS, acute mountain sickness? A. Diuresis, B. dyspnea rest, C. headache, D. lower extremity edema. So answer is dyspnea at rest, shortness of breath at rest. Question 82. Question 82. Treatment of chronic respiratory failure due to chronic bronchitis should include controlled oxygen therapy, B. redoxing, C. long-term administration of carbonic anhydrase inhibitor, D. corticosteroid. So answer is controlled oxygen therapy. Question number 83. Anterior wall myocardial infarction (AMI) takes place when the blood supply to the anterior wall of the left ventricle is occluded. Which of the flowing artery has been culprit in the anterior wall AMI? Answer is left anterior descending artery, B. left circumference artery, C. left marginal artery, D. right coronary artery. So answer is A. anterior descending, left anterior descending artery. Question number 84. Which of the following hepatitis virus have significant perinatal transmission? A. E virus, B. C virus, C. B virus, D. A virus. Answer is B virus. Hepatitis B virus. So question 87, 85. Our 25-year-old male presented with continuous bleeding from a cut in his forearm. What is the first thing you do? Compression of the wound. B. Open IV cannula, give fluid. Check pulse, BP, call for help. Obviously, stoppage of bleeding by compression of the wound. Question 86. Question 86. In a paraplegic, the loss of sensation with the level of T4, which of the following neuroendocrine response is lost? A. ACTH release, B. renin release, C. catecholamine release, D. vasopressin release. Answer is catecholamine release. A 24-year-old aspatite transgender female went into a clinic 5 years after starting high-dose estrogen therapy. She was previously diagnosed with gender dysphoria by psychiatry and requested feminizing hormone therapy. At the start of therapy, laboratory results including complete blood count, electrolyte, prolactin, gonadotropin were normal. Which of the following is the most appropriate test to monitor therapy-related complications? A. hematocrit, B. prolactin, C. prostate-specific antigen, D. serum electrolyte. Answer is B. prolactin. Moving to the question 88. A 28-year male brought from Karnali to the hospital of Kathmandu who is unable to move the lower limb after he fell down. He cannot control his bladder. The city of the Thumbo lumbar region was sent. The fracture could be in D10, D12, D12, D1, L2, L3, L4, L5. Answer is B, D12, L1. Question 89. Question 89. A child with fever and blood mixed stool and toxic is due to bacillary dysentery. The most common complication is A. Liver abscess, B. Hemolytic uremic syndrome, C. Shock, D. Severe sepsis. So answer is hemolytic uremic syndrome. Question number 90. In which of the following is prognosis related to incubation period? Prognosis related to the incubation period. So A. Rabies, B. Tetanus, C. Diphtheria, C. Cholera. So answer is A, that is rabies. 91. Which is the medical term for hearing voice that are not there? A. Delusion, B. Illusion, C. Hallucination, D. Obsession. Answer is hallucination. Question 92. A 25-year-old lady complained of sudden onset of breathlessness, anxiety, palpitation, feeling of impending down. Physical examination is normal. Most likely diagnosis is A. Panic attack, B. Anxiety disorder, C. Conversion disorder, A. Psychosis. So A. That is panic attack is the right answer. So 93. Question 93. A 65-year male has history of impairment in activity of daily living and recent memory. 65-year. He does not recognize his wife and has word finding difficulty in the absence of clouding of consciousness. What is the most likely diagnosis? A. Delirium, B. Dementia, C. Depression, D. Associative disorder. Answer dementia. Question 94. Which of the following is positive predictor of violent behavior in patient? Age, ethnicity, gender, level of education is age. What is the answer? Answer is the age in case of question 94. Question 95. A 25-year-old male present with dilated pupil, hypertension, agitation after substance abuse. Which of the following is most likely cause? A. Cocaine, B. Alcohol, C. Morphine, D. Benzodiazepine. Answer cocaine. Question 96. What is the incubation period of leprosy? 3 to 5 months, B. 1 to 20 years, C. 2 to 12 weeks, D. 6 to 10 months. So answer is 1 to 20 years. Question 97. A 12-year boy has localized non-secretory alopecia of his scalp with itching scale. Most likely diagnosis is A. Lichen planus, B. Tinea capitis, C. Alopecia areata, D. Tinea barbae. So answer is Tinea capitis. Question 98. A 55-year man presented with painful vesical rash on right side of the neck and shoulder without fever after a course of high dose steroid. What is the most likely diagnosis? A. Bonus pemphigoid, B. cellulitis, C. herpes zoster, D. varicella. Answer is herpes zoster. 99. Which of the following? Question 99. Which of the following condition microbes are seen? A. Psoriasis, B. Lichen planus, Pityriasis versicolor, D. Pityriasis sociala. Answer is Pityriasis versicolor. Question number 100. Which of the following drug act by inhibiting release of renin? A. Ethanol, B. Propanol, C. Captopril, D. losartan. Answer is propanol. Moving to the subjective question, second paper. So in section A, question number 1, a 42-year-old woman presented in acute exacerbation of bronchial asthma. This is the third presentation with asthma in the last month. Discuss the feature on history that would suggest poor asthma control and discuss how we manage a case of exacerbation of bronchial asthma. Question number 2 is the clinical picture of depression. How will you treat the case of depression? Question number 3. So it is second question is from psychiatry. First question is from medicine. Third question, describe the clinical presentation and management of organophosphate poisoning. Describe the indication for intubation in organophosphate poisoning. So this question is related to organophosphate poisoning from emergency. Section B 4. A 70-year male patient with abdominal distension, vomiting, absolute constipation for 2 days. On examination, he had distended tympanic abdomen with high-pitched bowel sound. What is the most likely diagnosis? How will you clinch it? What is the initial step in management? What is the complication of the condition if not treated on time? So this is related to surgery, mostly intestinal obstruction. Question number 5. A 40-year patient presented with history of nasal bleeding on your OPD. What are the causes of epistaxis? Describe the modality of treatment in case of epistaxis. So epistaxis from ENT it is asked. Question 6. A 7-year boy come to a clinic with history of fever, swelling, pain over the middle portion of the right leg, axis of right leg, so periosteal reaction, history of no histotoma, what a differential diagnosis, how would we write him and appropriate treatment. So this is mostly question from the ortho, like periosteal reaction, fever, swelling, like osteomyelitis. Now section C related to the pedia and gynae ops. So section question 7. A primary gravid woman came to your clinic with a history of frontal headache, disturbed sleep, epigastric pain for 2 days duration. BP is 140/100. His pedal edema present. Abdominal distension, so 30 week gestation, no likely diagnosis. How would you manage this case? So it is a case of preeclampsia. Now question 8. Pediatrics. So this is the common bacterial cause of acute bacterial meningitis in children. Discuss the CSF finding in acute bacterial meningitis and viral meningitis. So related to the meningitis in children. Section D. Question number 9. A sudden increase in the case of acute gastroenteritis has been reported in a small town. The local health department suggests contaminated water source. What type of epidemiological study would be most appropriate? Define the term attack rate and explain how it will be useful in this situation. What are the key steps in conducting an outbreak investigation? How will you differentiate between an epidemic and pandemic? So related to community medicine. Question 10. Describe the National Health Policy of Nepal. Describe the National Health Policy of Nepal, Act and Rules. So this much we discussed in a video which was asked in the Loksewa of Lumbini Province Medical Officer 2083. Thanks for watching the video. Hope you have got the idea of the question that were asked.